Hello, this is Mrs. Alston, and today we're going to be talking about the urinary system anatomy. So the average kidney weighs about 5 1/4 ounces and is about 4 to 5 inches long, 2 to 3 inches wide, and about 1 inch thick. The left kidney will sit higher than the right. So as I said before, the left kidney sits higher than the right because the liver is taking up the right upper quadrant. There are two kidneys, two ureters, and one bladder. The adrenal glands, which are not part of the urinary system, sit on top of the upper pole of the kidney. The adipose capsule surrounding the kidney allows for the faint visualization of the outline of the kidney on a plane KUB. The lower portion of the rib cage acts as a protective shield for the kidneys. The ureters are the extension of the renal pelvis coming off of the hilar region of the kidney. They attach to the posterior portion of the bladder at the triangular area known as the trigone. The ureters have slight peristaltic waves helping to move the urine down the ureters. However, gravity does most of the work. There are three main areas of constriction for the ureters. The first one is going to be at the ureteropelvic junction, or UPJ junction. The second is going to be the brim of the pelvis, and the third is going to be the ureterovesical junction, or UVJ junction. The upper pole of the kidneys lie at about the level of T11, T12, lying midway between the xiphoid tip and the iliac crest. The left kidney sits higher than the right, and the right kidney, the lower pole of that one, lies at about the level of L3. We're now going to look at the male versus the female bladder. The bladder serves as a reservoir for urine. The trigone, as I said earlier, is a thick fibrous area that allows the ureters to puncture through the bladder. It is on the posterior aspect, and the trigone attaches to the floor of the pelvis. The inner portion of the bladder has rugae, so just like the stomach, it allows it to collapse down when it is empty. In males, which is the image on your left-hand side, the prostate gland wraps itself around the proximal end of the urethra, which is the tube that allows urine to exit the bladder. The bladder can hold anywhere from 350 mLs to 500 mLs, with about 250 mLs typically registering in the brain that you have to urinate. On the right-hand side is the female bladder, showing you the urethra and the pelvic floor. So if you look on page 531, you'll see that the kidneys are retroperitoneal structures, which means that they lie behind the peritoneal lining. The large abdominal muscles, or the psoas muscles, are what cause the kidneys to lie about 20-degree angle from mid-sagittal plane. So this makes the upper pole of the kidneys closer to the spine than the lower pole. The psoas muscles cause the kidneys also to rotate back, resulting in a medial border of the kidney being more anterior than the lateral border. And then the kidney has a rotation of about 30 degrees, also due to the psoas muscle, and this is going to come into play when you start performing your obliques. So this diagram of the kidneys is just showing you where the kidneys lie within the human skeleton. So as I said, the upper poles of the kidneys are going to be around T11 to T12 and extend all the way down to about L3. This is a slide demonstrating the kidney anatomy. You can go to this video on the anatomy of the kidney, which is located on Blackboard underneath the IVU folder. So looking at a cross-sectional of the kidney itself, the outer surface is known as the renal fibrous capsule. Directly under that capsule is the cortex, and then you have the medulla, which sits just under the cortex. The medulla has 8 to 18 conical masses named the renal pyramids. The renal columns lie between the renal pyramids, and these dip down, forming the renal sinuses. The renal pyramids are a collection of tubules known as the renal papillae. The renal papillae drain into the minor calyces and then into the major calyces. There's about 4 to 13 minor calyces, which eventually merge to form 2 to 3 major calyces. They then dump into the renal pelvis, which is a flattened tunnel attached to the proximal end of the ureter. The general term known as the renal parenchyma is the term used to discuss the general function portion of the kidney. However, the microscopic functional unit of the kidney is the nephron. There are approximately 1 million nephrons filtering the kidneys. Please refer to this video, which is going to be on Blackboard underneath the IVU contact, to look further on the nephron. And then this video is going to show you the function of the nephron, which is once again on Blackboard underneath the IVU folder. So that concludes the portion of the urinary system, particularly the anatomy of the kidneys, the ureter, and the bladder.